Alright, let's talk about the test tube baby. One of the coolest things modern science has made possible. But test tube baby is just a nickname. The real term is in vitro fertilization, or IVF. Sounds fancy. I'll break it down step by step. Why do people need IVF? Sometimes natural conception isn't possible. Causes include blocked fallopian tubes, low sperm count, or unexplained infertility. IVF gives another shot at becoming parents. It's a medical option that helps many families succeed. Here's how IVF works, step by step. Step 1. Fertility medications stimulate the ovaries so multiple eggs mature. Step 2. A quick minor procedure collects the eggs under ultrasound guidance. Next, the partner provides a sperm sample, or donor sperm is used. Step 3. Eggs and sperm are combined in a lab dish. In vitro means in glass. Fertilization and early cell division happen outside the body. A few embryos develop over days. Step 4. The healthiest embryo is selected and transferred into the uterus. If implantation succeeds, pregnancy begins just like any other. Pros: IVF helps people who couldn't conceive naturally finally have children. It also enables genetic screening to reduce the risk of inherited diseases. Cons: IVF is expensive and not always covered by insurance. It's emotionally and physically demanding. And success isn't guaranteed. Often multiple rounds are needed. Fertility medications can cause side effects, so careful medical supervision matters. The journey can be tough, but many find the outcome worth it. IVF has brought millions of little miracles into the world, science making parenthood possible for many. Science is pretty amazing, right? If you found this helpful, hit like and subscribe. Thanks for watching.